right. Good morning, everyone. Good afternoon, everyone. Welcome to CRPN Central Live, the podcast where we bring some of the best of the industry's best right here to talk about the topics that we need to know most. Before we get started, CRPN is free for clinical research sites to join, free opportunities, affordable services, and so much more. So if you're ever interested in joining CRPN as a site, let me know. I'd love to have a conversation with you. Up on stage first is our co-host, Mr. Mitchell Hilby. How are you doing, Mitch?
Doing well. Glad to be back in the saddle again.
Yep, welcome to the saddle. You've got the microphone of ideas popping up over your head here. And before I bring our amazing guests on stage, Mitch, I have to tell you, what did you think of this podcast?
It was phenomenal. I mean, both of them. There was this really cool intersection between both of them at certain points, and excited to see kind of what they thought of it as well, and kind of where they collaborate. And I have some other thoughts that were brewing over the weekend of how it all kind of comes together full circle, and both of their insights really tie together really, really well.
I agree. And I think Miss Lucia, she used the word full circle a couple times in the interview, and it was totally perfect.
I'm a fan of full circle moments.
Full circle moments are amazing. And then, of course, the award-winning, spirited Lauren Stockwell. I have to tell you that. So whenever I do these, I have like 40 to 50 minute long interviews. But to fit it all into an hour, I have to cut the interviews down to the 20 minutes of what I think is the best in scope of what the topic is. But what you didn't hear in like the uncut version was a pretty extensive conversation about Lauren's award that she earned. And so before we start, Lauren, take 30 seconds. Can you describe that award to the audience since they didn't get to hear it in the final cut for the episode?
Way to put me on the spot right up front, Dr. Fox. That was truly one of the coolest moments in my entire career thus far. I had the great pleasure of winning the Site Summit Spirit Award. I call it my Miss Congeniality Award. But it was such a cool moment to be able to walk up on stage amongst all the other incredible honorees that evening and kind of represent the spirit that SCRS wants to bring to every summit that they put on and kind of show what it looks like in human form for that particular summit. So that was a really cool opportunity.
And congratulations. And Lucia, and for the parts that I had to cut from you were all of the cool engagements that you had with your employees. And you had some really cool opportunities there. And I'd love to get into that more. Before we go further, would both of you introduce yourselves really quickly?
Lucia, do you want to go first?
Sure. My name is Lucia. I am the Director of Research and founder for Evolve Clinical Research. We are a multi-site network in Phoenix, Arizona, with 7 clinics doing clinical trials embedded in private practices in pain management, family medicine, neurology, and pediatrics.
Wow. That's quite the combination. And pediatrics themselves, you could do all of the above in pediatrics and have it be its own specialty. Mm-hmm. Wow.
Yeah.
Well, what about you, Lauren?
Yes. So my name is Lauren Stockwell. I'm the Director of Outreach and Engagement for Clinical Research Fast Track. We are a boot camp training organization that really works to educate and empower and really connect the next generation of clinical research professionals. I actually use people like Lucia. She is one of our instructors. So it's so cool to be able to be featured together on that podcast and find out who my counterpart was and know her so well and admire her so much. But been working in this industry to help bring the next generation of research professionals into it. We train everything from research assistants through PIs and beyond.
Wow. And that I have a question for you. So tell the audience, when did you find out who your counterpart was?
Literally when you released, like 3 days before you released it. It was nuts because I remember I was grilling him, Lucia. I was literally like, Daniel, you have to tell me who it is. And he gave me a hint. He was like, you kind of work in a similar space. Like he was like involved with Fast Track somehow. And so I'm sitting here and I'm racking my brain and I am like trying to figure out who it is, like trying to like meddle around, trying to stalk people, all this stuff, trying to figure it out. But he told me that you work at a site and you're in site management and had something to do with fast track. And so you were on my list, like my target list, if I had to create like a hit list of who it might be. I didn't know, of course.
Yeah.
So I found out when you texted me, Lauren. I was like, wait, what? Which makes perfect sense. I mean, I have been teaching for clinical research fast track, not for a little bit, just because I haven't had the time to do so. But we have actually had one of our PIs go through training with clinical research fast track, and one of our coordinators actually came from there. So that's where it comes full circle as well.
Yes,
I love full circle moments.
Nice. It's gonna be the whole theme of this.
Yeah, that's the code. Hashtag full circle moments. Let's tag this one. And I do that on purpose because we found that if you know who you're interviewing against, you will change your answers. So we want to make sure that all answers are organic and you don't know who your counterpart is. It scares some people. It's weird, but
I was terrified.
I mean, but then when you hear the final comparison, these people, they don't know who they're interviewing against. They're answering the same questions. Oh my gosh, when you start to align everything that happens, it's just phenomenal. And this story did not, it was just amazing, simply amazing. So just as a precursor, so this episode was on staffing and personnel, specifically the training and the onboarding of staff members at the clinical research site. So we have Lucia, who is an experienced site owner who I think, by the way, how are they doing? Because I know when we did this, they were just starting off on the training journey. How's your team doing?
When did we do this?
Was it November? I think it was November.
November. Okay. So,
yes,
the coordinator started. Who was in training at the time fully signed off. She's been doing visits independently, already screening, randomizing. She has 2 studies that she's been assigned to lead, that she's been screening lots, randomizing lots. So, oh wow, that feels like a really long time ago.
You weren't kidding. It really, like 90 days and they're ready. They're good.
Yeah.
That's what I was going to say. That
wow.
The 90-day thing really stuck with me. And that's what I was going to bring up earlier too, is this weekend I was forced to watch Love is Blind. And the whole 90-day thing really then sunk in too, with like this 90-day fiance thing and how like the whole interview process, right? It doesn't even matter if you go through like some of these companies of like 2, 3, 4 interviews. You really don't get to know what those people are like until they're at your site, until you're working with them and you're building that relationship personally.
Yeah. So one of the coordinators that was in training, so we hired 2 people at the same time. Someone who was hired as a coordinator. That person didn't work out as a coordinator. They decided, you know what, I wasn't sure what I was getting into, that they didn't want to stay in clinical research, but the other coordinator did get fully signed off. And she actually came to us. The reason why we hired her was because she had some clinical experience as a medical scribe. And she's the first person we've hired with that type of experience. And my goodness, her documentation just insanely good. And it's made it so easy for, like we do QAs on all of the visits. And I just love reading her progress notes. It's so easy to follow. And that opens the door because now when we're posting, we're about to actually post another one. We actually are like, okay, let's look into medical scribes, not something we were looking into before. But she's done so amazingly well that we're like, okay, that's going to open up the door for other scribes to be considered.
Well, and Lucia, that's such a good point, because that's something that I really like to focus on, is not what you can, like what you have done, but what you can do with what you have done. We need to look at these things, and we have this arbitrary, like 2 years of experience, and that's the only indication that somebody can do the job. Well, we can things from our past into our present, right? And we're able to take these skills. Like, I worked with kids with special needs for years and years and years prior to getting into this industry. And that taught me a lot of communication, a lot of patience, a lot of really ensuring that SOPs are followed, in all honesty, right? And it's so important to understand, hey, there are things from every single type of career and background that can translate. And it's about identifying them. And like you said in your interview, Lucia, like highlighting the things that they're really good at, understanding what they're really good at and highlighting them, and then what they're not so good at and kind of shifting that off to somebody else who's better at it.
And that brings back to Lauren's example of the chef
Yes.
that came together and became an amazing CRC because of the chef skills and the
I
customer
forgot
service.
I talked about Katarina.
Mhm. Well, I didn't know a name. Now I
Yeah,
know a name. But
sorry.
you said there was a plumber, a
Yes,
chef,
yes.
the very dedicated people. I mean, there's so many people that could contribute to clinical research.
Absolutely. There are so many different backgrounds and different types of skills that people need in this industry. Some of the really common ones that I always recommend leaning into, teachers. Think about this, you guys. If we want somebody to stay at our site for the next, like, even year, 2 years, and be dedicated and empowered by the site, and we want somebody who's going to be challenged by that experience, it's so important that we take people who maybe are going to hit a ceiling, and maybe, phlebotomists, teachers, social workers, these people who have these great skills, but don't have the capacity in their current careers to get elevated and to challenge themselves. And we take those people and we put them into clinical research. You can teach anybody the medical terminology. I took a class on it in college. It's not that difficult. I actually finished that class in like a week when I was sick. And it was just fantastic. They're all over the internet, but you cannot teach somebody the patience of sitting and talking through something and educating somebody on a really big topic, informed consent. Okay, let's sit down. Let's have that conversation. Let's break up this really challenging thing into tiny little bite-sized pieces so you understand it and feel confident moving forward. That's a teacher at its core. How do you, what is y equals X, right? How do you break that down?
And you know what the sad part about that is? Odds are, if a teacher became a CRC, they'd get a pay raise.
Is it like double? Yeah.
Exactly. Yeah. But then again, they are now motivated by money, and they're wanting to stay at that site longer because they're already getting that pay raise.
And if you can rein in a sixth grader, I mean, come on.
I think that's so important too, because I think the biggest reason why I see someone be successful in their training and being able to not just become a coordinator, but move up in their career is the drive, is the wanting to always learn more and seeing what comes next. Like our current, now that you mentioned, you can teach anyone the medical terminology. We actually have our current clinical research assistant who didn't come with a clinical background or any type of research background. She came in and applied for an administrative position. And she came in during the interview and we were like, no, we're really trying to fit that clinical research assistant position. And actually in the interview, I told her, I'm like, this is actually the role we're trying to fill. And she was just like, I looked into it, what you do. And she was like, honestly, I don't know what it is, but I want to learn it. And
she's there like,
based on what I saw, and we just loved her personality. And we were like, this is someone who's going to come in. And if, she didn't rehearse the answers for the interview and truly does want to learn, is going to learn it. So she's actually in a medical terminology class now because next clinical research coordinator position that opens, she wants that spot and she's voiced that. Because she gets to see, like, even though she's not involved in the coordinator portion, she's doing mostly like data entry, labs, processing. She sees what the coordinators are doing and already knows she wants to do that. She's lining up to, when that position is available, is hers. And that's the research assistant I was talking to Lauren about, because we're trying to find ways to get her ready for when the position is open. So that she can.
Huge. That is huge. And you've provided this beautiful ladder for her and this kind of vision of what her future looks like at your organization, and allowed her to the opportunities to step into it too, right? You're putting her through a medical terminology class. You're showing her what her future looks like there. That's really a huge part, you guys, and anybody who's listening, of creating this kind of ladder for these people. They want the challenges. Give them, there's so many online certificates that are relatively cheap that you can help them gain and build up their resume. And it's so important that we continue to challenge these people at sites, because that's really where the bread and butter is of our entire industry, and where we need to support those staff as much as we possibly can and encourage them, not only through monetary value, but also through just different types of love languages for each and every single person, and different ways that we can communicate to people, and different ways that we can show them that they're appreciated by investing in them, both time, money, energy, effort, resources, whatever that looks like.
And I'm so glad you mentioned love language, Lauren, because that is, no, seriously, like one of the biggest problems, one of the biggest mistakes we ever do is we try to speak the love language of the one that we like to receive, not necessarily the one that everyone else likes to receive.
Correct.
And there's a lot behind that.
Correct. Like, for example, this is a huge thing for me. I am not money motivated one bit. And my boss, I've been very clear with my boss about this, right? But I work really well with words of affirmation. And so if I'm doing a good job, I need him to say, you did such a good job today. I'm really proud of you. And that's what feeds me more than, hey, let's give you a $5 Starbucks card. Like that doesn't do anything for me. But
I mean, unless you like Starbucks.
I mean, yes, of course, but everybody likes coffee. However, it's more important to me to receive those words. And so understanding your employees' love languages and the way that they receive love. And of course, this is kind of taboo, right? Many people are like, oh, love languages, relationships. Like, there is so much room for love languages in the workplace. And there's actually a whole quiz on what your workplace love languages is. And there's a whole way that you can test it. It's a whole thing. I'll try and put the link in the chat so that way we can give it to people. But it's definitely a really cool test if you haven't done it or had your employees do it.
The cool thing is, have you ever compared that to the 5 dysfunctions of a team?
Yes, absolutely.
It's amazing. Like the correlations are there.
It's insane. And that book is so good too. If you have not read 5 Dysfunctions of a Team, I highly recommend it. Anybody listening, it is so insightful and you're able to really understand the core of everything is trust and building trust and leading with vulnerability and showing people that you're willing to step up and step in order to support them as much as humanly possible. People leave leaders, they don't leave positions. And so I think that that's also a really big thing to anybody listening is be that servant leader.
Mm-hmm.
So that's one of those book club books, right?
Yes.
That's the one she's supposedly going to send me, but I'm still waiting. So
sorry.
I'm kidding. I'll get it myself.
I'll send it. I'm sorry.
Lucia, I wanted to move the spotlight over to Lucia. I wanted to ask you, like, after you heard the interview and you did the comparison, how did you feel about like Lauren's interview versus yours?
It made perfect sense for me that it was so cohesive. Because since before I even started my own sites and being in charge of training people and hiring people and everything like that, I was already working with Lauren. So I feel like she's, we connect really well in that sense. Right now that I'm trying to find a ladder for, how to progress research assistants to coordinators if they're interested, because they're coming at a different level than how we've hired before. Like she's the first person that I reached out to being like, hey, here's what we are envisioning. What do you think? And we were texting back and forth until now we have what comes after the medical terminology for our current research assistant to keep them motivated too, because we actually just hired an administrative assistant who also no clinical experience, no research experience. And even though this person is fully administrated, they're helping with regulatory. So I think it's going to be so important that they learn the research, like the basic knowledge of research. So first person I've reached out to just being like, here's the position that we have, here's where they're headed. What do you recommend? Like, how can we get them, to the place where they want to be?
So I feel like I picked 2 kindred spirits to interview.
We're like buddies. I admire Lucia professionally and personally, and it's been super cool to watch her grow and continue to develop herself personally. I think it's really cool to watch you speak on stage, Lucia. I mean, I told you
that was so amazing. She did so well. So for anyone who missed it, that was SOS, right? Yeah. Was that your first appearance?
That was fun.
That was so amazing. She did such a good job. I think it's recorded vocally. There's an audio only recording somewhere, but
right back at you, Lauren. Like I said, one of our coordinators came from clinical right after completing clinical research fast track. You always come up in conversations. Like every time I talk to you, I go back to Jordan. I was like, I just went to Lauren.
So Lauren, I'll pass it to you. When you heard the interviews, when you heard Lucia's interview and then yours, and you did a comparison, how did you feel about it?
I completely agree with what she said. I think her and I have been pretty much on the same wavelength. It was honestly incredibly validating because, every time you talk, you're like, I hope I'm on the same wavelength. And especially when you don't know who you're talking against, like you kind of get that freak out sweat dripping down your back moment of like,
what if I'm wrong?
What if I'm wrong? Like, I think I'm right, but what if I'm wrong? So it felt very cool to understand not only the perspective of my perspective from a training side and coming from a third-party trainer, but also understanding that we're literally now speaking the voice of the site. like I'm able to now stand up a little bit taller because I understand her side and her perspective and her challenges and the things that if I'm able to represent that and speak that, let's do it. Let's continue to empower the voice of the sites. Let's continue to talk about the issues that you have at site. Because again, if we don't have those sites, if everybody at site quit tomorrow, we would have nothing. And so the point here is we need to continue to scream out loud, because with volume comes change. And that is so important, to have people like Lucia that's so willing to speak to her experiences and to her own challenges, so that way other leaders can at least relate to it and understand it and hopefully take best practices away.
Yeah, that's
go ahead, Mitch.
Where you guys really aligned to like even further define that was this concept of those transferable skills, not just looking at someone who they are, maybe just on paper, right? Getting to know them, having them go through their 90-day fiance program with Lucia, and figuring out, right, how they best fit though, and where their strengths are and where their weaknesses are, and not just sitting around necessarily. You don't have to wait forever if you're willing to work. I think that's it. It's like you don't have to wait forever to find like this perfect unicorn candidate for your role. If you're willing to actually work with the people and get to know them and help them find the role that best suits them.
We have a comment. Thank you, LinkedIn user. Yeah, I like that as well. So with volume comes change. And I feel like we as an industry, we're cranking that volume really quick. You get everyone on that amp finally speaking up. When you have enough people saying the same thing, people start to think that it's true. They'll know it's true. So one of my favorite comparators. So we have all kinds of comparators I could talk about here, differences and similarities. But you both mentioned a scenario where you treat the staff member with respect. I know, Lucia, you said that you have like all those cool milestone celebrations. Like once a year, you take your employee out and you talk, and sometimes you just talk, just to hang out and talk. And I know, Lauren, you said first impressions matter. What do you want from Starbucks? There's Starbucks again, but it's all about literally putting the spotlight on that clinical, the personnel, and letting them know that they are worth the investment. They're worth your time. They're not just, and I don't remember, maybe both of you said it, but we all know that there are those staff members in clinical research who are literally just their first day, bam, here you go do this. No instruction, nothing, trial by fire. And they're just like, this is not great. I don't like this. This is bad.
Yeah.
So can you tell me an example of both of those that you've seen, the good and the bad, the positive experience with your personnel, and then maybe the stories you've heard, because I know it never happens at your site, but the stories that you've heard about, like the things that aren't great.
So I think that's why I invest so much time, resources into training, because I have been in that position before. My very first research job, I was a research assistant, wanting to become a research coordinator. And they were like, someone just quit, you can become a coordinator. And that person had 12 trials. One of them was the highest enrolling in the country. And there was only one other coordinator at the site. And I, for months, literally was leaving the clinic at 11, coming back at 6.
Oh my God.
And just because I was so concerned about, like, I am working with patients, this can have huge consequences. And there was no one to train me. And that is something too, where our coordinators know you will not start seeing patients right away. And if they come in as a coordinator, they're eager to start seeing patients. They want to be doing all the things and be hands-on, but we're like, you know what, these are the steps before you get signed off, and you do not do anything until you get signed off, because what we're doing is so significant, not just for the clinical research area of it, but the patients' lives. So that's where me being so strict about the training, and again, investing so much of my own time, getting the coordinators that are already trained to help train other coordinators, is just to make sure that they do not have that experience, that they do not, if within those 90 days they decide this is not the right place for them, or this is not the right career for them, that I know it's not going to be because they were overwhelmed and because they didn't have the right support resources in their training.
So and this is like a Lucia origin story here, but it almost sounds like you are developing what you wish you had when you started.
It's her revenge plot.
No, it's
was
a
a very
full
scary
circle
time.
moment. It's a straight up full
Full
circle
story.
moment.
There it is. That's a nicer way to put it. Full story moment.
Revenge plot. That's so cool, Lucia. That's like, well, and now you've got so many coordinators, and you've demonstrated that if you do it the right way, you can be so much more productive.
Yeah, and I that too. I'm with you, Laura. Where obviously money is nice, but I always tell people, I'm like, you cannot pay me enough to wake up every day and go do something that I don't absolutely enjoy.
Yeah.
And I've been lucky enough. I've been doing this for 13 years in February, and I'm still learning every day. I still love it every day, and that for me is a huge thing. I want people to wake up in the morning and actually be excited to come in to work with us. And I constantly hear that from the coordinators. So I'm like, okay, something's working out, even if it's very stressful when we have new staff to be spending so much time in training. It's just such a beautiful moment when I see it work out, or when a coordinator does a visit on their own and they're so confident and doing it so well. I'm like, all right, this is why we do it this way.
Yeah.
That's what I'm talking about. So what about you, Lauren?
Yeah. On top of what she said, because you have such fantastic insight there, I also want to challenge everybody listening that if somebody is coming to you and wants to grow, like Lucia is a perfect example of this, so we're not talking about her, but like if somebody is coming to you and says, I want more, I want to be able to do more, I want to be able to give more, I want this position. I just spoke with a past student today who was in that position. She's 6 months into her career at this point. At a research assistant level, and she went to her manager and said, I'd love to learn how to become a CRC, right? That's a normal trajectory. That's a normal ladder. It's not like she's like, I want to be manager tomorrow, or anything like that. And the manager said, you're not ready. That's all she gave her. She didn't give her any steps. She didn't give her any ways to get ready. She didn't give her any sort of thing. So I had a strategy call with her today of where she should look next. And I just want to say, yeah, I just want to say that like that's where we're really kind of cutting ourselves off at the knees. Is we need to understand that when entering a relationship with somebody as a entry level candidate, we need to understand they're going to want to grow. Nobody wants to stay at the entry level for their entire lives. So we should look at this as a dating process that we're still getting to know each other. We want our relationship to grow and develop and change. And, over time, we're going to move in together. We're going to fall in love. We're going to get married. Right? We got to do all these things. Sorry, I'm bringing up all the weird topics. It's fine. It's an afternoon conversation. We're cool. Some of us may have a glass of wine in our hands. I don't know. But anyway, the point here is the relationship evolves as should the title and the pay raise and that kind of thing. And we need to recognize that if somebody's coming to us and wants that for themselves, how can we help make that happen? Or how can we work, at least give her something to work towards instead of just saying you're not ready. Okay, well then when will it?
I get so excited when anyone comes to me. I don't care if they've been there a day, months, and they're like, okay, what's next? Or I see so-and-so doing this. How do I learn that? Or what's the next step? I get so excited about that because I'm like, okay, that means that they're also looking at their future with us. It's not even just their own future, but how they fit into Evolve Clinical Research. So I get super excited about that.
Yeah. And your
company, right?
Sorry, Mitch, what?
Yeah, I was saying exactly, Lucia, like how can they help your company? How can they grow with you and you grow together?
Yep. So, and Lauren, what I'm hearing is it sounds like Clinical Research Fast Track is going to start teaching research admins sooner than later, right?
Yes, I believe so. We get a lot of organizations send people to our program to kind of offboard their onboarding. And that's a really cool resource to organizations that have that perfect front desk assistant or have like a nurse that's kind of in conjunction with research and doing a little bit of it and has all this great background of it and wants to get into that side of things. So we do a program where we're training individuals from the site.
Well, I just wish that you could have that little sit down, come to research moment with that administrator that's just about to lose an employee because of something they said.
If I knew her, I would, in all honesty. Like, I'm all for let's be open and honest with each other and let's have full transparency because, again, people leave leaders. They don't leave positions. And I think that she literally just lost a fantastic employee or at least lost the trust. Talking about 5 dysfunctions of a team, that is the basis of any sort of building a team is trust. She just lost her trust.
Yeah. Well, I have to tell you, so one thing that always bugs me about staff training is people love to use the word retention. They love it. And I'm sitting here like, okay, I get it. You don't want to always be training people, but guess what? This is a research site, so you'll have to get over it. What are your opinions about retention? And by the way, this is something that was cut out of Lauren's interview, like about 4 minutes worth. So I know Lauren's got something to say about it.
I don't even know
But
what I said.
oh, yeah. So, for me, I get it. Keep employees happy, keep them there as long as you can, but you cannot retain them forever. You just can't. But how do you, I mean, there's so many things. Let's talk about retention just for a little bit here. Lucia, how do
I joke
you,
around
how do you
with
address it?
all of my, well, with my team where I'm like, we're all gonna retire together, and I'm like, not when the youngest person retires, but when I retire because I'm the oldest. I always joke around where I'm like, and I tell them, I'm like, I would love to keep you forever, just because I just absolutely love every single person I get to work with right now. But then I'm like, that may not be realistic. And I even tell them, if it gets to the point, if you're trying to leave because you're outgrowing us faster than we can grow, tell me to see if there's anything we can do. There are certain things that we might be able to alleviate what's going on. If not, I tell them, like, I'll be your reference. I will be your reference. I will help you find what comes next for you if this is no longer it. Because again, it comes with, they have to love what they're doing every day. They have to enjoy coming into work. And if that goes away, how much longer is someone going to be able to stay there? And then I even tell them, I'm even transparent about money too, where it's like, if it's about money, tell me. I'm like, we have a lot of, we have two big universities doing clinical research near us, big hospitals, big networks in Phoenix. So that's who we are competing with.
Yeah.
So I'm like, sometimes I'm like, okay, I cannot match what they're offering, so I'll be your reference.
Yeah.
But not everyone's going to stay forever. And again, that even with the opportunities for growth, some coordinators are going to outgrow us faster than we can grow. And that is okay. I would be happy enough if they go somewhere else and they can be like, oh, wow, what a great coordinator they trained, or great staff that they sent us, so it's okay.
Yeah, absolutely. To just like piggyback off of that, I also think as leaders, we should want that for our employees. Like, we should want them to find this beautiful new path. We should want them to be bigger and brighter than our organization could ever allow. It's such a cool thing to be told as somebody that is young in her career. Like, my CEO has always said to me, I know I won't have you forever. I know. I'm very well aware of that. But for as long as I can have you, let's make you as happy as we possibly can. And let's talk about the things. So we even have a quarterly check-in, him and I, where we just sit down for an hour and just talk about what went right this quarter, what felt good, what didn't feel good, and how we can shift and be better in the next quarter. It's a conversation. It's like a 45-minute conversation. We're not asking for hours and hours and hours of discussion. But the fact that he took the quality time to sit down with me and ensure that we're having a touch base, right? It's like a check-in to ensure that we understand where each other's faults are, understand where we have to both grow with each other, and where he can help support me and where I can help support him. That's a really big thing. Helping people connect to their why is also a really big part of it. And I'm now remembering that's probably what I talked about in this retention conversation. I cannot remember exactly, but helping people understand why they stay is a really big part of building any sort of longevity inside somebody's career, right? Sometimes the pay is not going to be great. Sometimes we're going to lose patience. Sometimes we're going to, have really tough or boring days, frankly, right? Entering data all day is not the most exciting thing in the world. But understanding the bigger picture and understanding how we connect to this big, beautiful world of medicine is so huge. So even just asking people, what are your stories? Why did you want to get into this industry? And then honing in on that, right? My very personal connection is my grandpa passed of cancer back in 2013. And I got 6 extra years with this man because of modern
research.
Medicine, because of clinical research. And I got to live and grow up with him and live with him for a lot longer than I possibly ever could because of medicine. And how cool is that I get to live his life out and continue to represent people and bring people into the industry that is saving people like him.
Mm-hmm. And who knows how many extra years other people are going to get to enjoy with their loved one because of what you are doing right now.
Mm-hmm. I literally wore a shirt today that I designed with Fast Track. We designed it this year, and it says "Adding more birthdays."
Aw.
Yeah, that's great.
So I've got a question, but we're going to get Kelvin's question here in a minute. I did want to say one thing. The worst thing your site can ever have is a disgruntled CRC, ever. That's where you hear the horror stories of the forged source, the forged documents, the things that are happening that are really, really bad. Is that CRC who is very unhappy, who feels that they're being cheated.
Yep.
Avoid that at all costs.
Oh,
at
man.
all costs.
I've
I
seen
can
so
tell
many
Mitch.
stories. Yeah,
Mitch,
with,
I'm sure you've seen some of these, but they
false-
get bad. They get really
false
bad.
claims to the FDA that trigger, inspections and everything. But
Yep.
yeah,
It is 100% critical to keep a finger on the pulse of your CRC's well-being.
I think the
Absolutely.
important thing with retention is it's retention and not restriction, right? You're not trying to trap anybody in those roles. You don't want them. I mean, it would be nice if they're there forever, but they're not stuck with you,
Yep.
and you want them to grow.
The whole not feeling stuck is so important. I just had an experience recently with the coordinator, a discussion about a coordinator leaving, not that recently, actually, it was sometime last year, but where they seemed so surprised about when they came to me being like, you know what, this isn't it, I want to go. I was like, all right, how long do you need before you find the next job? Can I be a reference? And left that door open. And I think they were so surprised by that, where I was like, it shouldn't be uncommon. That should be the norm. Where if someone wants to leave, it's not something against you. You just simply are not the right place for them anymore.
Yeah.
But I was very surprised by that, where she was like, "Are you serious?" And I'm like, yes.
No, that's that's
how
natural.
can we help you?
Every single industry that I've been in, people they feel like succession is a bad thing.
Yeah, I can totally see Lucia sitting there like helping them with their CV.
Totally, like formatting it.
I'm like, good luck on the interviews. This person actually stayed on board with us as an unblinded pharmacist, so we still get to see her every once in a while.
Well,
we just had a team event and went to the movies, and she went with us because
that's so cute.
It doesn't have to end badly. It's just normal progression of someone's career.
And I do want to devil's advocate side of things for just a moment. I believe in what you're saying 110%. I also understand the frustration of having to train and retrain and all this kind. I get it. I get why there is a hesitation towards this. I understand it, but allowing more space and less restriction, like what Mitch said, will keep them longer. It will keep them happier longer. It will give your name and your brand in the industry much better results and much better reviews and all these things. So short term, I get it. It's frustrating. Long term, big picture concepts, it's going to help your organization as a whole.
Well, you create an indirect sense of loyalty among your group. Like, I guarantee you, Lucia, you've got people probably across the industry now saying things.
I was expecting Lauren's famous little quote here too.
What famous little quote?
The whole train them well enough that they can leave, but
well
enough that they won't want to.
I wouldn't call it famous at all, but it may be on a t-shirt at some point, because I like to put things on t-shirts. But yes, that's a really good point that Mitch just brought up. I actually was chatting with him at the SOS conference, and we were talking about this, and it's so important that we do train them so well that they can leave, and then we treat them so well that they don't want to. Anybody can move on at any point in time, but if we're treating them well and if we're engaging them and helping them grow, that's when they won't want to leave.
And also no one that's made it through training and actually made it through the 90 days and gotten signed off, everyone who's left has been so mindful about the amount of time they give us to hire someone, offering to help train that new person, and making sure that their studies and their patients are taken care of. So I think if you leave that line of communication open and make it okay to leave if it gets to that point, it will allow you more time for transition.
For sure.
Well, you'll eliminate the rage quitters, and you really don't want that in a trial.
I have one more story about this. So my first job out of college, speaking of what Lucia just said, I literally gave him 3 months notice. My boss, 3 months notice, which is not normal. I know that's not normal, but like, I had so much respect for him and the organization and them giving me a chance right out of college, right? And I just did not want to leave them high and dry. And I didn't have something lined up at the moment. So I was like, okay, I'll give you 3 months notice. That's fine. I was actually planning to go back and get a master's degree. So I was just going to school. We're good. And so at this point, I decided to give him this huge long notice. And he actually got me my now job.
Oh, wow.
So like he introduced me to my current boss. And that's such a cool full circle moment of if we show respect to our previous employees and our employees, they will show respect back to us.
Mm-hmm. All right, Kelvin, as promised, let's go to this. So Kelvin says, do you use the ACRP guidelines to help structure training and onboarding programs for new CRCs?
I'm going to take it, Lucy, or me?
So we've actually put together, we have a training checklist, and I talked about this on the podcast and at SOS, where even though the training checklist is objective, how someone progresses through it is very subjective. Mm-hmm. We let people know these are all the things that you're going to need to know. If there is a coordinator, we actually don't have one for administrative assistants or the research assistants because those are new roles. But for the coordinator role, we give them this long list. And even when we were training 2 coordinators at the same time, they didn't progress through it at the same rate, or there were certain things where they wanted to spend more time on, less time on. We just give them a guide as to, until all of this is checked off, you're not doing a visit independently. But it has everything that a coordinator may need to know, even with certain things listed, like as an SAE, for example. Sometimes we just explain the concept, let them know you will get signed off because you may not get to see one in 3 months, hopefully. And when it comes up, then we're going to fully train you on that because there's only so much that we can do with scenarios. But what we try to do is be very transparent about the amount of things that they're going to be learning and what they need to learn in order to get to that place. So that list has been, every time that we get a new person, that list gets updated because they'll tell us like, oh, I just saw someone doing this, that's not on the list. And we're like, okay, let's update it. Mm-hmm. So we're constantly updating it to, it's something that it looks very different than it did for the very first coordinator, our very first coordinator who's transitioning into clinical operations right now, actually looks at that and she's just like, that's not what it looked like when we first started. So it's been adapted quite a bit. We adapted sometimes, like we changed a lot coming back from SOS. And just the ideas that we got actually from the panel that I was a part of, from the other people in that panel. Mm-hmm. But we constantly update it so that it's as comprehensive as possible.
And you know what that reminds me of, Lucia? And it just brought back the memory again. What you described there reminded me of when I was a kid, when you like go for your Boy Scout badges. You have a little handbook and you have to go through there and sign things off when you finish them. And sometimes it's seasonal, like, you're not going to go camping in the winter or anything like that. But right. You have this big, long list of when you do all of this, that's when you get your giant Eagle Scout Award. Mm-hmm. And you just have to, it's a marathon. You have to go through there. That's what it reminded me of when you talked about your checklist, is being in like Boy Scouts.
Mm-hmm. There are certain things that thankfully don't come up as often. And so we cannot fault someone for not being exposed to it and not getting the training for it until it comes up. We actually had our latest coordinator to get signed off where she got to see everything in 1 week. It was like her last week right before getting signed off, where there were things that we were like, when it comes to it, we'll sign you off. And it was just like visit after visit. All of these things were coming up. And I feel like she learned more in that week than she had in the 2 months that she had been doing that for.
Mm-hmm. Mm-hmm. So what about you, Lauren?
Yeah, absolutely.
Same thing, or?
Well, yeah, to piggyback off of her, I mean, we've designed our curriculum to really be a foundation, but at the end of the day, this is an industry where Lucia just told us she's 13 years in and learning something new every single day. Mm-hmm. And so while our entire program is entirely based on those core competencies of clinical research, and it's so funny, when we were developing the curriculum originally to present to post-secondary board and say, hey, we want to make a school, which that's what you do if you want to make a school. We did it, and then they came out with the core competencies, and it was like verbatim the same exact, essentially.
Right along the lines.
Super cool, right? Again, validated. I didn't make it, but validated. Sorry, I meant to tap myself on the back. I don't know why I hit my head. But anyway, the whole point is it's important to use those as a foundation and build away from them as well, and also build off of them and show people all the different scenarios that can pop up, because I have teachers that come into the room that are 20 plus years in, and they're like, something new happened last week. I had to call in and figure out what to do with it. And so we're constantly learning and changing and developing. And so the fact, Lucia, that you make it a working document, that should be more of our mindset. Is that the learning doesn't stop. The learning isn't limited to this one list. You are not going to be the perfect CRC. And even if they're a great CRC there, if they shifted to a different therapeutic area at a different site, they're starting from ground zero. And I think that that is the coolest part of our industry, but also something that we need to keep in mind is that everybody needs to continue to pursue more training, pursue more education, pursue more understanding, ask questions. Ask questions till you are blue in the face at any point in time. And that way we can really engage in meaningful conversation that's going to help us get from where we are to where we need to be.
And I think it's so cool.
No, go ahead, Lucia.
For the people in training to be able to look back on that list and all the things that they have learned, or where they are at 90 days as opposed to day one. I think the coordinators love that, to be able to just be like, oh, I remember when I thought this was going to be the most difficult part of my job, and now I'm doing this. So I think that's actually pretty cool to look back on. With one of our coordinators, we just recently found out her very first progress note, actually. And we were looking at it, and she was just like, oh my gosh, I can't believe that was how I thought my progress note should be. So those things to look back on, it's actually pretty cool.
Absolutely.
I remember we used to do what we called micro mentor programs. Ooh. Where we had everyone at the site, they were specialized in something. One was really good at IATA and labs. The other one was really, really good at consenting and source. So we let everyone take on a little piece of that training and pass the mentee around to everyone. So they all got to learn the very best of the best from all the specialists at the site.
That's cool.
And it was cool because, training takes a lot of work. So if everyone trains a little bit, it works out.
Well, sorry, continue.
No, that was it.
It's like, and to add on to that, that also empowers each of your staff members to take on a leadership role.
Yep.
Right? I think that that's such a cool thing that we're missing here, is that everybody has that opportunity to lead and teach somebody else, to do something and to teach something, two very different things. And oftentimes it helps people learn differently and learn their job differently if they're having to teach it. Because questions come up that, you may be like, I don't know, actually, but I thought I was the expert in this. Mm-hmm. And all of a sudden they're getting to lead, they're getting to manage, they're getting to do this without actually having that management title.
Yeah.
Yeah, there are certain things where I have the coordinator, like multiple people train on the same topic. Like adverse events, comments, for example, where I feel like it just has to click. I do the first training, but I have them go and work with every coordinator, because I think the way that we all have learned it and what has made it click for us has been different. So it helps to make sure, like, okay, they may not understanding how I'm explaining it, but someone else can explain it a different way, and that might be what helps them understand that big concept.
And by doing that, you're empowering ownership into those employees as well, which is such a cool concept of retention. Talk about retention. It's giving people this sense of, I have control over helping somebody else understand this too. And then they get to watch that person grow. They get to say, I had a small, it's like literally bringing drugs to market, you guys. It's that concept into retention. We get to look at this drug that just got released into the market and be like, I had a small little piece in that. Well, why don't we go look at this CRC who just checked off her 90-day list and say, I had a small piece in that.
Yeah. And it's so cool. It is inspiring to see an entire site's team, all of the coordinators, wrap their wings around the new person. It is so cool. It is just very, very inspiring. They all care. And from that new employee's perspective, you always have that feeling like you're getting thrown into the deep end and nobody's there to help you, and it's like you against all the wolves. No, it's like a pack mentality almost. Everyone, you take care of that new employee until the new employee can stand.
Yeah.
So
yeah,
very good.
Till they get that aha moment and everything just clicks and suddenly it all makes sense. Same thing with
such a cool moment.
Yeah, they come in one day and they're just like, I get it.
I get it. I can do
When
it.
you see that light bulb turn on, those light bulbs, I mean, it just shines up the entire site. It's so wonderful. So, I mean, I'm looking at this. So Kelvin, shout out to Kelvin. Thanks for coming, Kelvin. I love the dynamic nature of your training and accountability to ensure competency. I agree completely. I think that's definitely the way to go. And absolutely, Lauren, and amen. Need to adapt to continuous learning mindsets. Yes, please. And that's the other thing is, and I think Lucia definitely alluded to this, you never stop adjusting how you train your employees. You're always adapting. You go out there, you learn, you apply the best. I mean, how do you stay so nimble in such a structured environment?
Yeah, the industry is constantly changing. I mean, you have to. If you don't adapt, if you're not working on, new processes and new trainings, and you're just going to be further and further behind.
Ooh, Kelvin. Yeah. So examples. Can you show an example of how you've adapted your learning and development using CQI? Like, what did you learn and how did you adapt it?
So for us, it's pretty simple. We're a small team. For example, for the visits, even if I'm not, like today I'm in our admin office, I'm not at any of the sites, I am looking over all the visits that are being done, so I can see where more training may be needed, just by looking at the visits and the data that's being collected. But we're a small team, even though we're at different clinics. We're always every week, we're all at least one day all together in the same site or clinic. So it's not necessarily, there's that connection there between all the different components, that there's no separation between, one team and another team. We're all overseeing the person who's in training.
Yeah.
Yep. What about you, Lauren?
I'd say, honestly, this is a little different for me because, I'm not working at a site. I'm not working in that sort of dynamic. For me, when it comes to addressing and acknowledging skill gaps, we're all going to have gaps. Every single one of us has gaps and place. It's just like what I just said. I'm not working at a site, so that's not my expertise necessarily. I work with a lot of sites. But what I would say is open the conversation. Always just have that conversation and say, hey, listen, where do you feel like you're falling short? Where do you feel like you like your job a little less? Or what do you love to do about your job? And kind of listen. And when I say listen, I want to be very intentional here and say actively listen. Because I think so often we're like, oh yeah, they don't like doing data work. And then we still give them all the data work to do. And instead of that, try your best to say, okay, well then let's start to work on getting that off your plate. Can we identify other people who love to sit at home all day and enter data? Can we identify other people who thrive in that setting? And can we offload that stuff to them and then give this person more of the patient interaction or the recruitment flyer creation? Or how can we creatively get in with people's job descriptions where we're having the conversation constantly and ensuring that person, again, it's a touch base. That's the biggest thing. And offering that safe space to fall short is so important. Because if I don't have a safe space to fall, I'm going to hide things. I'm not going to be as open and honest about what I like a little less. I'm not going to be as, willing to share that kind of information.
Mm-hmm.
That's what we do. We ask, when we're having one-on-ones, and again, we have our 90-day review, which is our official sit down moment. But by the time we get to the 90-day review, it's kind of like we've already discussed everything we needed to discuss. We do it throughout. But I do like to ask, like anyone I work with, like, what do you want to do more of? What do you want to do less of? Yeah. And there are so many, like if you're working in any role in clinical research, even though you're a coordinator, there are so many different hats that you're going to have to wear regardless of the role, that sometimes it helps to learn, like, okay, this may not be the strength for this person, but it is for this other person who really enjoys doing it. let's pair them together.
Yeah.
We've had coordinators who are like, nope, I don't really like doing admin. I just want to see patients. And I'm like, we have the need for that. So let's give you more patient visits, and let's give recruitment to the person who enjoys talking on the phone with the patients, because I think we're in a field, and I think that's why I enjoy it and still enjoy it so very much after 13 years, that there are so many areas. And even in my day-to-day, right before this, I was working on the finance portion of it, which I didn't get to do until 3 years ago. And I realized, like, I was like, oh, I actually really enjoy this. I can sit down and do it for hours. And there are certain things that I don't like as much. So as soon as someone comes up to me being like, oh, I want more of this, and I'm like, yes, because I want less of that. So let's give you more. Let's give more to you.
Yeah. And I'm sorry, one thing to bring up, I know Kelvin has a question. Sorry, Dr. Foss. But so one thing to bring up that you just said at the 90-day review, nothing should be a surprise, right? Like, we shouldn't be like shocked at what information is brought to the table. That's a big part of it. Is if somebody is falling short and continuing to fall short, let's have that conversation. There's a great book, and I'll send it to you as well, Daniel. But Crucial Conversations is such a cool book where you're able to really dive in to have those conversations, and really ensure that these people understand and receive the information well, because I mean, we're all going to fall short at one point or another. Let's have that open and honest feedback from each other.
Yeah, I like Kelvin's next question here too, regarding doing a root cause analysis and CAPAs, and I'll jump in on that real quick too, because if it's a protocol deviation, I can say that your SOPs at a site are not protocol driven at all. The protocol deviations happen. Sometimes they're out of the site's control. Sometimes they are, as a result of a process. And if it does result in a CAPA, you still have to determine, was that, is there really additional training that needed to be provided for everyone as a whole? Is it really just, does your RCA result in a one-off issue with maybe it's just this one staff member? But if it's protocol driven, a lot of times, maybe it's the IP is dispensed weird or whatever it may be, it doesn't necessarily impact like your SOPs, your training processes. It might, require a little additional protocol training, but not necessarily for your site staff as a whole.
I've got an example for you, Kelvin, and here's this. This happened. This is real happened, and it wasn't the employee's fault. It was totally the process's fault. But one of the most severe things you can ever do in clinical research in your trials is to mess up the informed consent, right? We all know that. Well, what would happen if the CRO just so happens to send the wrong version date of the informed consent to the coordinator to use?
Oh, no.
It happened. So it happens a lot, unfortunately. One of the most common, most severe deviations you can do is the utilization of the wrong version date of the informed consent. And almost every single time it happens because the CRO messed up. So don't get mad at me, but you have to have the internal processes in place so that your regulatory specialists at your site know what is going on. So you have to create your processes, and you have to develop CAPAs to the point where your coordinators know to check in with your regulatory team, your regulatory specialists, whoever that might be, because they are the ones that are most attuned to the IRB. Yeah. And when you do that, whenever you get a new informed consent from the CROs, that's when you make the decision. So you have to create that internal quality system, and therefore you had to readjust your training, because you have to say, okay, coordinators, you cannot believe what the CROs give you. We have our own internal checks. Make sure you check it internally before you process it to the patient. So, and see, Kelvin, unfortunately, I see those a lot too. So it happens a lot. And we as a site have to have the internal processes to get that going. So guess what? It's been an hour already.
Oh, wow.
I know.
That flew.
We're going to go ahead and wrap up, but I did just want to say this was a truly inspiring episode for me, because it told me that we have a lot of very like-minded and passionate people out here who want the very best for our coordinators and for our staffing. And just on behalf of CRPN Central, I really appreciate everything that you're doing for this industry. You are inspiring generations of improvement and progress for this industry and for this world. So for that, I want to say thank you. So let's go ahead and wrap up. If you wanted to tell something to the entire industry, face to face now, not just with your voice, and this won't get cut out, so you got to watch what you say. What would you tell the industry about personnel staffing at the site level?
Do you want to start, or do you want me to?
I'm sorry, what's that?
Do you want me to start, or do you want me?
Oh, go ahead. Yeah.
Okay. Well, first off, thank you for having us. Seriously, this has been so super cool, and the follow-up part of the conversation has been really cool as well. I would say, if I had to say one thing, is to continue to have that curiosity, continue to have that sense of wonderment that most of us started in this industry with. I think that it's so important that as we continue to think about staffing and different and creative ways to staff, because let's be honest, what we're doing is not working. And so why would we continue to do the same thing and expect different results? I think it's so important that we, again, continue to lead with that curiosity and doing something different and gaining something different and really being a part of an industry versus just a siloed, this is what's working for me, I'm only doing this, I'm holding tight to what I know has worked in the past. It's not going to work forever. So let's continue to expand out. Lucia.
Amen, sister.
Amen, sister.
Go ahead, Lucia.
I think what I would say, especially if we're talking about staffing, keeping in mind the significance of what we're doing day to day. We're literally changing medicine. We're changing lives. So let's give the people at the front lines, the people involved in this process, regardless of what level they come in, what role they're going to play, give them the right training, the right tools, the right resources, and invest in their growth. Because what we do is too significant to think that it is acceptable to bring someone in and not give them the appropriate training to perform the role.
Mm-hmm.
Amen, sister.
Amen, sister. All right. Mitch, my sister, you ready?
Yes, dear. Yeah, I'll do a little a fun little takeaway too. Positive reinforcement, embracing everyone's strengths, valuing the different perspectives, really honing in on that empathy. And then, of course, for me, it's always this aspect of playfulness and having fun with your site staff or whoever it is that you're with. So they, at the end of the day, they all feel Twitter-pated, and you want to have that good 90-day fiance relationship. Sister Mitch, I love it. I'm gonna wear a whole outfit next time. Should I?
Please.
Can I have a little nun outfit?
And then like and subscribe, of course.
Yeah. All right. So staffing and personnel training is always very important to me. I can't believe I had the opportunity to talk to such wonderful people. Thank you for tuning in to CRPN Central. Please like, comment, subscribe. And for all of those who stuck around for the hour, this may be Kelvin, we may have some very, very big news to announce very soon. And I think there's a lot of people on the screen right now who know exactly what I'm talking about. And that's about as far as I'm going to go. So we'll, have to stay tuned. If you like, comment, subscribe, you might know about it sooner than later.
True.
Bum, bum, bum.
Bum, bum, bum. Question mark. All right. Thanks everyone for joining.
Thank you for having us.
See you next time.
Nice.
All right. Bye everyone.
Bye. Thank you.